All right, so this is a medical advice disclaimer, and then here's what I do. Here's the 4 journals: Alternative Therapies in Health and Medicine, Advances in Mind-Body Medicine, the journal Microbes, and the journal Microbiology Research. I'm a reviewer for the Journal of Immunology Research, and I'm on the editorial board of these 4 other journals. So that's what I do. And here, again, all information. I'm here to educate people, whether they be lay people, the public, or they be healthcare professionals. I am here to help people understand this, and not from a monetary standpoint. So I don't profit from this. I'm not trying to sell you anything. The key to solving medical problems caused by toxins: the first point, it is detect the cause. The second, remove the cause. Third, repair the damage, and the patient is healed. I'm going to let you in on a great big medical secret now. Are you ready? Big medical secret. The right diagnosis with the right treatment equals the patient is well. The wrong diagnosis, the wrong diagnosis and or the wrong treatment, what happens? Patient stays sick for years. They get treated for, things like chronic Lyme. Believe me, there's a number of studies, not 1 or 2 or 5 or 10, but many studies that show that is a myth. So let me continue on this call. There is a movement within the FDA that says that laboratory developed tests, LTDs, are now going to be looked at very carefully. Why is that? Because there's a lot of tests out there that are not valid tests. Let me show you just one of them. Use of unvalidated urine mycotoxin tests. Urine testing is not a validated test, okay? There's other ones. There's actually a study done on the information provided with what is called the GI map, and they said it's not a valid test. So, and there's many more like that. So anyway, here we go. Here's the sensitive patient. Why are they sensitive? The wrong nutrition, and then they can only eat a few things. 2, there's too many supplements. I mean, they're not taking 3 or 4 or 6 or 8 supplements. They're taking 20, 30, 40, 50 supplements. And the third issue is if you have MCAS, which is mast cell activation syndrome. And this is caused by IgE antibodies to mycotoxins. That creates a sensitive patient. So instead of going around and trying to treat this or that or the other, the treatment is to basically find out if they have antibodies to mycotoxins through the MyMycoLab testing, and then treat that, not all these other things and going around, because they won't get better. I have a shocking kind of a thing to tell you. Here's a new study on supplements. 11% of nearly 60 tested dietary supplements actually contain an accurate amount of the key ingredients that are listed on the label. So 11%, so more or less 6 or 7 out of 60. 40% did not contain a detectable amount of what is on the label at all. 40%, folks. This is why I'm very strict with with which supplements I recommend to my patients. I've put this in a webinar called Treatment Paradigm, and it's available again on MyMycoLab's YouTube channel. because those really contain what is on the label, not 40% that don't contain anything at all that's on the label. So let's talk about what actually people have been eating. Maybe they're not eating this today or this year, but they've eaten this throughout some period of their life. These are foods banned every other country, but not here. Okay, let's look at that. Artificial food dyes or colorings. Where would you find that? Well, we just had Halloween, and the candies for Halloween, cereals, baked goods, candy, sport drinks, sodas, mac and cheese, macaroni and cheese, and many, many more. Why it's bad? Because yes, they make it look pretty, but it's made from chemicals derived from petroleum. Petroleum also makes gasoline, diesel, and tar. Doesn't belong in you. It belongs in your car or your vehicle, not in you. Farmed salmon. If you don't see line-caught salmon, it's farmed. Why it's bad? Because they're held in huge pens where, imagine 100 salmon in your bathtub. That's what these poor fish have to tolerate, okay? So farmed salmon are raised on a diet of grains. They're given antibiotics and other drugs, and the flesh is kind of gray. Then they give them synthetic astaxanthin made from petrochemicals, so they look pink. Don't fall for that. If you're going to eat salmon, eat line-caught salmon, not farmed. Here's another one. Brominated vegetable oil, where it's found in sports drinks and citrus flavored sodas. Why it's bad? Because these chemicals are toxic, okay? And they're corrosive to the body. And they give damage to organs. They give birth defects. They can cause schizophrenia and a lot of more other things. Don't. Brominated vegetable oils should not belong in your diet. Olestra, where it's found. Fat-free potato chips, French fries. Who hasn't eaten potato chips and French fries? Why it's bad? Well, it's supposed to lower calorie count, but this is a cooking oil substitute, Olestra, and inhibits your body's ability to absorb very important and vitamins, essential vitamins. Okay, here's another one. Azodicarbonide, where frozen dinners, boxed pasta, packaged baked goods, and various breads. Why it's bad? It helps bleach flour, okay, so it looks whiter. And so plastics as being other synthetic. So what are we talking about here? We're talking about the why it's bad. It's found in milk and dairy products. So please buy organic milk. Okay. Cows treated become infertile, developed inflamed others. And if you think as a human you're immune, forget it. These have been linked to breast, colon, and prostate cancer. So it's definitely not good for you. All right, let's go on a little more. BHA and BHT, where it's found, cereal, gum, butter, meat, mixed nuts. Why it's bad? Well, they help food from becoming rancid, which is theoretically okay, but they've been shown to cause cancer in rats. And let me tell you, it's a step away from causing cancer in humans, and it's not a risk. worth taking. Arsenic in chicken, poultry. What I mean by poultry, okay, is chicken and also turkey. What they do is they put it in the artificial feed that they give these poor chickens and turkeys, okay? What it does is it swells the stomach so they eat more to fill the stomach up and become fatter quicker. It also helps the flesh look more pink, but it's anything but. Arsenic is a human carcinogen. It's not good for you. As a matter of fact, if you heat up arsenic, which is a white powder, it turns purple. So when you're down to the bone in these chickens, it looks purple, doesn't it? That's where it comes from. Potassium bromate. It's found in these wraps that people eat, rolls, flatbreads. Many restaurants serve that, bagel chips, breadcrumbs, etc. It's harmful. It's made from brominated vegetable oil and brominated flour. Well, what does that do? It decreases the time it takes to bake these. And of course, by decreasing that time, it decreases the cost. But it causes kidney damage, cancer, and it affects your nervous system. Now, the question comes up, does organic chicken turkey have arsenic? No. Ractopamine. This is essentially, ractopamine is a alpha adrenergic product, and they use it especially in pork because everybody wants their bacon to have more meat than fat, etc. So they give it to the pigs before they're sacrificed, okay? But it affects the animals, and also it's linked to heart problems and toxicity in humans. And where do you get this? Ham, salami, bacon, and pork meat. All right, what else? Mercury, heavy metals. So there's a lot of people out there who test for heavy metals and then say, oh, you have to detoxify. No, you don't have to. You just quit eating these things and it goes away. Okay? And I mean, sushi, as an example. What about canned tuna? American lobster, cod, fish and chips, cod. Okay? All these have mercury. Don't eat them. What do you need to avoid at all costs? Anything that has artificial flavoring, artificial coloring, artificial preservatives, artificial sweeteners, soy in any form. Don't eat canned foods. The canned foods, the lining inside the can is a chemical product. And please don't microwave anything in a plastic container. The question comes up, speaking of fish and pork parasites, that's not where you're going to get them. You don't, unless you eat raw. Raw, yes. Otherwise, no. Foods to avoid: breads and breakfast cereals, cake, ice cream, sweets, frozen or packaged meals, soft drinks and fruit drinks, pizza, salty snacks, packaged baked goods, chicken nuggets, fish nuggets, and bottled dressing and sauces. How common are these? Do you have any in your pantry? Throw them out. This is a warning about glutathione because, again, this is popular because these healthcare professionals don't really read very much in the medical literature. And this is a study from 2006. If you have gliotoxin, mycotoxin in you, and you take glutathione, it increases the cytotoxicity of gliotoxin makes it more toxic to your cells. Okay, so please be very careful when these people want to stick a needle in your arm and give you glutathione, even orally. Okay, so and this is 2006, folks. This is not new, but people don't read anymore. So here, the compromised intestinal barrier induced by mycotoxins. This is a study. It's now 3 years old. So the intestine is considered as the first barrier against external contaminants. And it consists of interconnected physical, chemical, immunological, and microbial barriers. Okay? How much, and the question comes up, how gliotoxin toxicity from glutathione presents clinically? I would recommend that you go and watch my webinars, because the explanation would take me 20 minutes and we just have a lot of things to go through. Again, these are all on the MyMycoLab YouTube channel. So the average person eats about 1 ton of food a year. Yes, I know that's probably pretty surprising to a lot of you, but it's 1 ton of food. And the first barrier is the gut. So here's the gut. There's a barrier function. There's anatomical and histological layers. There's 4 of those. There's 3 cell types, and there's layers of protection, which are 3. Okay, so the barrier function, the first one, it's the microbiome. Okay, it's the epithelial cells of the gut and the immune cells in the gut. The epithelial cells, the whole gut is one layer of epithelial cells, and they're connected to each other through desmosomes, adherens junctions, and tight junctions. This is studies. We'll get into that in just a minute. Okay. So remember here that this is the microbiome is actually helping our health. That it's an essential part. If you took the gut and laid it out, take a normal average person and you take all their gut out and lay it flat, it would cover a tennis court. It's huge. Okay, here's the 4 anatomical layers in the gut: the mucosa, the submucosa underneath that is the muscularis propria, and under that, the muscularis mucosa. 4 layers. Then the intestinal epithelium has 3 different cell types. Epithelial cells make up the great majority. And then there's the goblet cells that make mucin, a type of mucus. These are in the villi, which are the little kind of fingers throughout all the gut. And the third are the Paneth cells, which produce antimicrobial peptides in the crypts. Then there's 3 layers of protection. The epithelial cells are connected by these desmosomes that I mentioned, the adherens junction, tight junctions, and these kind of form a mechanical bond of adjacent cells to produce a barrier like a fence. This barrier blocks entry of large particles like undigested food, etc., pathogens, which are bacteria, viruses, etc. But it's permeable to water, electrolytes, and nutrients. Next is a chemical barrier, and that is made up of mucus, antimicrobial, meaning antibiotic type peptides, and cytokines that are secreted by these epithelial cells that make up 80% of the lining of the gut. So here is another comment. If a patient glutathione with toxicity with gliotoxin, true. Talked with a patient yesterday who validated his very bad experience with glutathione. He had taken glutathione for 2 months. He experienced mood disorders, severe brain fog, difficulty thinking, and feelings of doom. Okay. And here's another question. If a patient has insufficient glutathione, elevated GGT, and genetics showing decreased glutathione production, do you still recommend avoiding supplementation in the presence of gliotoxin? Absolutely. You don't want to make the patient more toxic. Okay, so the next slide, the third barrier is the immunologic barrier. It consists of the lamina propria, which contains capillary and gut-associated lymphoid tissue, the GALT, that are made of immune cells. These are macrophages, dendritic cells, and lymphoid cells. In addition, secreted immunoglobulin A and cytokines are produced by the immune system to complete this protective barrier or fence, as I like to call it. There are more neurons in the gut than in the spinal cord, and the microbiome is continually and persistently exposed throughout life to foods, liquids, and chemicals. Okay, remember, 1 ton a year. So here is this barrier, this fence. The top part, as you can see here, is the microbial barrier, the commensal bacteria. Commensal meaning these are normal part of your microbiome. Then comes the chemical barrier. You can see that all the way on the left. This is the mucus layer, showing the mucins. Then there's the physical barrier, these epithelial cells that make up 80%. And you can see on the right the tight junctions between each cell. Okay, each one of those where you see the round red circle, those are cells with the nucleus. And these have occludin, claudins, etc. And this is what Dr. Fasano, Alessio Fasano, found and developed. Then at the very bottom is the immunological barrier, the immune cells. You can see there's the Paneth cells that we were mentioned. SIgA stands for salivary immunoglobulin A. There's the goblet cells, and T cells, B cells, dendritic cells, and macrophages. These are part of the lamina propria. This study, you can take this, that's at the very bottom. That's the study that showed this, and you can find it in the National Library of Medicine, which is pubmed.gov. So here's Sibo. You don't treat the Sibo. You treat the cause of the Sibo. Remember one of the first slides I showed, which is this one. The one where I tell you that detect the cause. The Sibo was caused by mycotoxins. Okay, so don't treat the Sibo, get rid of the mycotoxins, treat the mycotoxins, and then you will have success. So here's a pre-itraconazole, June 10th, 2021, 3 months later, during the itraconazole treatment for mycotoxins, you see the difference, okay? It's very, very clear. Now, let's talk about neurotransmitters. On the right part of this, it says mechanism of actions at the top. And on the left, it says gut microbiome metabolites. So, for example, you need all these to have a normal functioning microbiome. And you can see the large amount of neurotransmitters. That's the first one, neurotransmission. The Second one is BBB integrity, which is blood-brain barrier. The third is brain and neurons energy metabolism. The fourth is neurodevelopment, especially important in newborn, and actually the fetus, newborn, children, etc., and neuroprotection. Okay, so this is vital to have this microbiome. So let's talk about the enteric nervous system, the ENS. The enteric nervous system is a specific part of the autonomic nervous system. Autonomic translates, if you want to, if you're a layperson, it's automatic. You don't have to think of digestion. Your gut moves by itself. You don't have to will it to, okay? And these are found in the wall of the gastrointestinal tract from the esophagus to the rectum, and is responsible for all the gastrointestinal activity. And again, this is a number of how many nerve cells. This enteric nervous system is the second largest after the brain. In addition to neurons, the enteric nervous system includes a number of glial cells. These are called enteric glial cells, essential for the gut to work normally. Okay, and these enteric glial cells play an important part in the development of neurodegenerative diseases, including Parkinson's, Alzheimer's, Creutzfeldt-Jakob disease. So again, you don't treat Parkinson's, Alzheimer's, and Creutzfeldt with those kind of drugs. You get rid of the cause. And what's important here is also, remember, the enteric nervous system is the second largest after the brain. Okay. So, how do mycotoxins affect this enteric nervous system? They cause demyelination. What does that mean? That means slower movement of the gut. Okay? That means gastroparesis, where the stomach doesn't digest. And so the patient comes in, I can't tolerate this food, that food, the other food, etc. Second, it causes mitochondrial dysfunction, which kills cells. Cell apoptosis is the death of cells. So instead of treating mitochondrial dysfunction that's all over the internet and Dr. Google, why don't you go to the cause and get rid of the cause, and then there's no mitochondrial dysfunction. It's that easy. Mycotoxins produce reactive oxygen species and oxidative stress. All of this affects cells and mitochondria. Lastly, it affects the motility of the gut, the secretions inside the gut, the conduction of sensory stimuli, which means essentially feeling full, feeling bloated, feeling cramps, feeling pain in your abdomen, and the regulation of blood flow in the intestinal wall. So let's take it to food a little bit now. Here's deoxynivalenol, a well-known mycotoxin, usually from the mold called Fusarium. Look at the last three lines. An adult with a body weight of 170 pounds would have to eat at one time 14 pounds of oatmeal or 20 slices of bread. Now, this oatmeal and the bread is rancid, smells awful, looks terrible, to really cause a problem. I have a question. What are the best tests for digestion issues? Best test is do the mycotoxin test by MyMycoLab. Once you treat that, the gut gets well. All right. Certain foods can contain mycotoxins. It's usually due to poor storage after harvest, and is more common in certain areas of Africa and certain parts of rural China. So then you have the National Institutes of Occupational Safety and Health, the CDC. There's low levels and can be found in some foods, but it's parts per billion. It's too small to cause any serious health effects in humans. And the amount of mycotoxin tested in foods have been shown in many studies to be below what is called the tolerable daily intake, TDI. That's set by the FDA, the European Food Safety Authority, UN, World Health Organization, all these experts. So low levels can be found in cereal, beans, fruits, grape juice, beer, coffee, okay? But that's why people can find it in their urine, because that's where the body gets rid of stuff. You get rid of it in urine and in stools. And you can find it in urine in healthy people. Look at the last line, healthy people. It doesn't mean they're sick. Now, that's very important because a lot of healthcare professionals want urine tests because it's easy to do, but it's totally inaccurate. Let me show you why. So this is the flaw in urine testing, and this is from a published study. The variability of mycotoxin concentration in urine is based on daily intake. So you should do the urine sampling at different time points during the day. Okay, and then it's very challenging because of factors such as what is your gender, age, diet, muscle mass. All of those can influence the test results. So it's inaccurate. And in the beginning of this webinar, I told you that the FDA is starting to crack down on some of these unvalidated tests, and this is one of them. Now, what did this study also show? They showed that the ELISA method to detect mycotoxins in human serum, the same one that MyMycoLab does, comes with significant accuracy, precision, and specificity. And that's what you want. This study was published a year ago. Well, a year and 1 month, October of last year. And it's called the Analytical Validation of a Direct Competitive ELISA Test for Multiple Mycotoxin Detection in Human Serum. Okay, so what else? Binders, the great delusion, the big fake on the internet, okay? There's a question here. I was told not to worry about zearalenone. Well, I cannot agree with that. That is contrary to everything that's published in medicine, in medical journals. So no, you should worry if you've got zearalenone. But if you got it through a urine test, then throw it out because it's not valid. It's not a valid test. So let's go to the next one. Here's the big myth. Mycotoxin colonize the gut, so you have to pull them out with binders. Whoa, what a big fake. There's one study on binders, and here it is. No, actually, it's wait a minute. Hang on here. Okay. So yes, and then here we go. Okay. Where, here's a study that showed that mycotoxin in food is in countries with lacking implementation of adequate food safety policies. And remember, notably, one mold species can produce several mycotoxin and vice versa. Okay? Different molds can produce the same mycotoxin. And what is the first point of contact in humans? It's the respiratory system. That's the first point of contact during inhalation of mold spores and mycotoxins. Remember what I said in the beginning. Mold spores carry mycotoxins like a key on a keychain. So there's even a connection between mycotoxins and Parkinson's, as another study mentioned. So what studies, this is the one study, and here is your question on zearalenone. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the blood. Okay. What are these binders? Kaolinite, clays, activated charcoal, bentonite, zeolite, blah, blah, blah. They're effective in neutralizing only aflatoxin, and aflatoxin is not found in indoor air environments. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. What are these macro and micro elements? Zinc, magnesium, things that we need. So let's go further. What foods should you eat? I told you what terrible things we have in our foods. Frozen berries and frozen vegetables are okay. Local honey. That means go to a guy who has beehives and sells them on the weekends on the side of the road, things like that. Use olive oil for cooking and pour it on your salads. If it's extra virgin, it's even better. Don't use canola or vegetable oil. Use the 3 B's to cook: bake, broil, or boil. Don't fry. Okay, that's very simple. Taking the enzymes while, oh, here's a question. Can you comment on why mold illness has gone from completely unknown back in '85 to nearly everyone having mold sickness stories now? I can comment on that. It's because more and more publications and chapters in medical textbooks. I've published in the last 30 years, over 100 studies. I've also have chapters in medical textbooks. Ask your doctor if he's read any of these. Taking enzymes while taking medication for killing mycotoxins, yes or no? No. Is organic soy acceptable? No soy in any form. So what should you eat? Organically grown fruits and vegetables. Eat a variety of different colors: red, green, yellow, etc. Steamed or raw is best. Avocados, these are fats actually. Avocados, nuts, seeds, and extra virgin olive oil, EVO. Dark fruits. What do we mean by that? The blueberries, the blackberries, those are dark. Organic chicken and beef. And you can also add detoxifying plants, cilantro, very common in Mexican food. Cauliflower, broccoli, cabbage, kale, radishes. I love radishes. Brussels sprouts, turnips, watercress, arugula, horseradish, wasabi, artichokes, one of my favorite vegetables, and beets. Those two I love. Garlic. Use garlic in on your foods, salads, etc. Ginger, lemon, olives. So, like for instance, instead of getting a bottle of salad dressing, lemon, some lemon juice mixed in with some olive oil, and you stir that up and pour it on your salad. Delicious. Olives. I love olives. What to drink? Anything you drink should be from glass, not plastic. Those are all contain hormone blockers. You shouldn't drink out of plastic. No beer or liquor while you're trying to get rid of molds and mycotoxins, okay? But you can have red wine. Why? Because red wine contains resveratrol, okay? Okay, so those are the things you want to take. So here's a question. My stomach is the issue. What can I help? The pain and digestion. I've I guess it's ochratoxin and gliotoxin. Well, if you do the treatment with all the supplements that is in my webinar, that is the treatment paradigm, you won't have these issues. Don't ever drink tap water, okay? If you like herbs, grow them. There's nothing wrong with herbs, but if you have the bottled kind that you brought at the store, throw them out. Try to eat some probiotics daily, and this will help your digestion for your stomach issues, etc. So eat probiotics, kimchi, sauerkraut, etc. Now there's a statement here: all wines in the U.S. are contaminated with glyphosate, even organic. I would have to actually see the study on that, because in my information that is incorrect. Here is basic principle. Base your diagnostic testing, what tests you use, and treatment, not on opinions on the internet and blogs and unvalidated testing and unproven treatments, but on medical and scientific evidence. Can you take probiotics because it's hard to take? Yes, and I discuss this in my webinar on treatment. So the most accurate and precise test for mycotoxins, as you saw by that study published a year ago, both IgG, which shows a toxic reaction, and IgE, which shows mast cell activation, measurement of 12 different mycotoxins for a panel of 24 test results by MyMycoLab. And this test is available internationally. For example, because I'm the medical advisor. I'm not in the lab. I don't go over there, etc. They have test tubes and all that kind of business, and you can't contaminate, blah blah. So they send it all over the planet. You mentioned the place: Cyprus, Malta, Cambodia, Australia, New Zealand, etc. Okay. There's a question: if you have IgG immune replacement therapy, that will affect the testing. We have a problem with the local labs sending specimens. The problem is the local spin and trep. Can you try to work something out? Well, again, that's probably in one particular locale, but such as Hawaii, but we get a lot of serum from all over all the different islands from Hawaii. So here, important, after you start treatment, you take the urine test after 6 months. Okay, don't forget to do that. People ask me, what's a normal test look like? This is a normal test. Okay. So here's another one. People getting their healthcare practitioner give them fluconazole. Well, as you can read, there's 2 types of molds on this planet: single cell and multiple cell. Single cell are all the yeasts. That includes Candida. And yes, fluconazole, which is diflucan, will help that. However, fluconazole is not going to help the multicell molds, which are Aspergillus, Stachybotrys, Penicillium, etc. Whereas itraconazole is effective against both. Okay? So that's the important part. Make sure you get the right treatment. So what about the safety? Oh, if you take itraconazole, Dr. Google says your teeth are going to fall out, your hair is going to fall out, you're going to fry your liver, blah, blah, blah. So here's a question. I've been on itraconazole for 4 months. Would your testing still be helpful? No. you should wait till it's 6 months. What can I use for granuloma fungus on my skin? Itraconazole. It's from inside out. I recently tested a 21-month-old kid and the test is positive. Is the test reliable? Yes. How do I get tested if I cannot stop the IgG therapy? I have common variable immune deficiency. What test can I take? None of them will work because IgG is pooled immunoglobulin, meaning they get it from many, 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 many donors. And you don't know if those donors, if anyone did or did not have mycotoxins. Let me tell you about itraconazole. It's in this study, published 6 years ago. Itraconazole, known as Sporanox, is a common antifungal agent that was developed in the 1980s. It's been in clinical use for 35 years. This is as of 2017. So now it's 41 years with an established safety records. I do have positive for mold IgG. Well, that means sometime in the past you were affected by molds. It doesn't say anything about mycotoxins, okay? Can I discuss the phenomenon of fungal dimorphism, how body temperature turned filamentous bacteria from a filamentous form to a globular yeast colony in the body? Yes, I can, but we're running out of time. And that's easily a 20 to 30-minute discussion. So anyway, this has itraconazole, 41 years, 35 in 2017, 6 more years now, 41 years of safety. Something you may not know. You can't send anything that you don't spin down. Don't send blood, you have to send serum. This is a serum test, okay? You have liver disease in your family. My mother died of primary biliary cirrhosis. Can I still use the medication? That's going to depend on what's the condition of your liver. That's a simple blood test. Here's itraconazole on cancer. They investigated itraconazole for non-small cell lung cancer, prostate cancer, basal cell carcinoma, and they show positive. It's used now in many cancers, especially ovarian and recurrent breast cancer. Okay. Can you spin at any speed? No. And you have to have 1.5 hours. You have to wait 1 hour and then spin it down for 20 minutes. So taking itraconazole for these 2 cancers revealed significant increase in overall survival. Here's a comment. I've watched all your videos, and I very much want to use your treatment paradigm. Again, that's where I discuss all the treatments, hour long. I was formerly seeing functional medicine, was trained by Neil Nathan, but have not made progress for 3 years. Folks, it takes 6 months to get over this. Here's a person, spent all this money doing all these different things for 3 years, and is still sick. And now she says, I have limited funds. Wow, isn't that terrible? So here's a screening tool, and I give it out freely. It's there's 2 pages. It tells you if this person is really having issues with mycotoxins. On the left column, it says severity, 0 to 10. And on the right, when did you first notice this symptom? This helps you screen. And that is so important. Now, here are 3 studies, and I have, as I said, over 100. That would be really helpful to you to understand. So here's the top one: mold, mycotoxins, the brain, the gut, and misconceptions. The second one, mycotoxins and their effect in children. And number 3, the brain and mycotoxins, okay? If you want any of these 3, let me know. Don't pay to get them. I can send them to you free. Now, if you have any questions, email me at immunedoctor@gmail.com. Next Wednesday, 3 p.m., noon PST, tea time with Dr. Campbell. Ask any questions. Lyme disease, heavy metals, co-infections, molds, mycotoxins, anything. Okay? So if you want any of these studies, the questionnaire, etc., email me. And my question to you is, do you want 3 p.m. Eastern Standard Time, noon Pacific Time, or would you prefer 8 p.m. Eastern Standard Time, which is 5 p.m. PST? So I got one that says noon, and I got another one that says 8. I got second 3 that say 8 p.m. Okay. So anyway, here's next Wednesday. We'll do it at 8 p.m. Okay. If you want to do the protocol, sure. I'm getting a lot that say 8 p.m., 8 p.m., 8 p.m. So again, I'm going to do it at 8 p.m. tea time with me. Tea is healthy. It's got polyphenols, especially if you drink green tea. That's very healthy for you. Okay, folks, here we are. The bewitching hour is upon us. I hope you learned a lot. Actually, this gut issue on mycotoxins, I could do 2 or 3 of these webinars. And again, there's several webinars that I've done in the past that go through certain aspects of the gut. I appreciate you joining. I appreciate you listening. Where do I find the complete protocol? You go to MyMycoLab's YouTube channel, and you'll see all my webinars there, and it's the treatment webinar is there. I did it even a second one recently. All righty, folks. I hope this was helpful for you. Take care, and we'll see you soon.